With respect to specific rooms, I want to address for a minute the operating rooms in this hospital. We feel very strongly that this hospital should have operating rooms in the operating theater. We recommend that there be 2 full operating rooms in the operating theater. And these rooms should be specifically purpose-built to do what is referred to as minimally invasive surgery. Minimally invasive surgery means the type of surgery where you enter the abdomen, let's say, by these little tiny incisions, and you operate by looking at a television monitor, and you use small instruments without ever putting your hand inside the abdomen. This is the new way of doing surgery, and it has taken over as the most effective way of providing surgery. So in most parts of the world where people are doing what is considered standard surgery now, the gallbladder is no longer taken out by a big incision on the right side of the abdomen. The gallbladder is taken out through 3 little incisions around the belly button and in the upper part of the abdomen. This minimally invasive surgery has proven to be the best way to provide surgical incisions. It's safer for the patient. The patient recovers much more quickly. The patient has fewer complications, and the patient leaves hospital in a very short period of time. In fact, this is considered by so many people as the way to provide surgery that universities now in their teaching programs are training surgeons to do minimally invasive surgery almost exclusively. The surgeon of the future who will work in Montserrat will no longer be doing the open surgery that is currently done. They will be doing minimally invasive surgery because it is the best way to provide surgery. There will always be some need for open surgery, but this is in a minority of cases in just about every surgical specialty. Montserrat, in building a hospital for the future, needs to have a hospital built to do minimally invasive surgery, and there are particular specifications. Operating rooms which are built for minimally invasive surgery will permit you to do cases through the open surgery, the old way. But operating rooms which are built for open surgery are not going to easily permit you to do minimally invasive surgery. So we recommend that the primary hospital operating rooms in this hospital be built for minimally invasive surgery. They happen to be expensive, and the equipment in a minimally invasive surgical unit is expensive. But this is the best that we can do for our patients, and that has always got to be our primary concern. I'm not sure how I'm doing for time, but I'll just say very quickly in passing that there are other reasons for having 2 rather than 1. I know the population in Montserrat is small, and that might be a criticism. Why have 2? The first reason is redundancy. Hospitals require redundancy. What happens if for some reason your one operating room happens to not work? What do you do? How quickly can you, how long can you wait before you operate on other urgent cases? It is not appropriate, in my view, to have just one operating room of this kind in a new hospital. There are other good reasons for having 2, and I will discuss this maybe in the question and answers, because I think this is a wonderful opportunity for Montserrat to set itself as a place of excellence and to use the opportunity to provide minimally invasive surgery in a fashion, in a manner that is not currently being done in the Eastern Caribbean. Montserrat can excel in this, and you can do this through a combination of the minimally invasive, the other minimally invasive room and the visiting consultants program. If the government wants to look at this, I think this is a wonderful opportunity for another revenue stream for Montserrat. I also believe that there should be a third operating room in this hospital, an operating room, a small operating room that we usually refer to as a minor operating room, which should be set up in the emergency department. This will take care of the lumps and bumps. It's a cheaper operating room to operate. I will say in passing that the operating room is probably the most expensive part of a hospital, in any hospital. So if you don't have to bring somebody to the expensive operating room, don't do it. That's what the operating room in the emergency department can be and should be used for. I'd like to go on quickly to some of the other specialized rooms that we want to see in this hospital. We think that it's important that there be an isolation area in the hospital. Up until this current pandemic, maybe it would have been hard to sell this. But we now know that what we are experiencing is not a one-off phenomenon. What we're going to see over and over again are other pandemics similar to the one that we are experiencing. There will be many more cases of airborne respiratory diseases, and Montserrat has to be in a position to deal with that. As a result, we recommend that a special purpose-built isolation area be part of the hospital. We recommend that there be 3 beds, which will be built to industry standards, and that would be properly equipped with a certain type of air circulation and properly sealed in an effort to prevent spread of these respiratory viruses from inside the patient's room to the outside. We won't go into the details with respect to these rooms, but just let us suffice to say that there is a necessity for us to have isolation rooms in Montserrat. Now, obviously, you're not going to need these isolation rooms at all times, but there are rooms that can be used by other patients, especially patients who would be willing to have an upgrade of their standard hospital room and pay for that, because these are going to be nice places. They'll pay extra, and this would be a revenue stream for the hospital. The final specific recommendations that we had with respect to beds in the hospital was in maternity care. We feel that the hospital should adopt what is referred to as a labor, birth, recovery, and postpartum system for the delivery of pregnant patients. What that means is that a woman who is pregnant, comes into hospital in labor, is going to have all of her care in one big room. Patients over the years have found this to be the ideal way to have a baby. So they are in labor, and then they deliver, and then they have their postpartum care, and then they leave from that room. This room has to be well outfitted and big enough so that the partner, the husband, for instance, can sleep in that same room, which will house the woman and her baby after birth. All of the equipment and supplies necessary for monitoring that birthing process are also going to be in that room. It's a very efficient way of having a birth. Again, we recommend that there be 3 of these units, 3 of these LBRP rooms, as they're called, built in the new hospital. Right next door to it, there should be some type of a newborn ICU. We don't expect that this will be a big unit, but 1 or 2 bed unit, I think, would be appropriate. And finally, this hospital needs to have a regular ICU, because there will be cases where patients have need for intensive care, such as people with heart attacks, people with strokes, and so on. And our current hospital, Glendon Hospital, does not have that. This should be built into the new hospital. I realize that we're running out of time, and I am therefore going to just switch to a topic which I think is the part of all of this that I want to emphasize. A hospital is more than bricks and mortar. A hospital is more than nice equipment and state-of-the-art units. You can have the best equipped hospital in the world and still not have good care. And I want to make the case that Montserrat needs to look very closely at developing the type of culture in the new hospital that will allow us to provide the best possible care. We should look into having this hospital accredited. Accreditation of a hospital means that there will be an outside body that will come to the hospital, look at the way we provide care, look at the services, speak to people, and determine whether we are practicing good care or not. I must tell you that there are groups that do just this, and one of them is called Accreditation Canada, and every hospital where I've worked take this very seriously, because it's a very bad thing to lose your accreditation, because it says to the public that you are not doing good work. By the same token, there are not a lot of hospitals in the Caribbean that are accredited. I want Montserrat to be the exception to this, and it's not impossible. There's certain things that will be necessary. The hospital needs to have the right personnel running it. Montserrat needs to invest in a properly trained hospital administrator and staff that will run this hospital. The hospital would also, the administrator would be assisted by what we've referred to as a professional advisory council. This would consist of the heads of the different clinical departments, medicine, surgery, obstetrics and gynecology, etc., and the chief of nursing, who, with the administration, would formulate policies and practices to guide the practice of medicine in the hospital. In addition to that, we are recommending that the hospital, the people in charge of healthcare in Montserrat start right now and not wait until the new hospital is present, to create a culture that is going to be appropriate for the proper treatment of patients in the new hospital. That culture does not presently exist at Glendon Hospital. What we're recommending is that this hospital adopt the principles of total quality management. Now, that's a specific way of doing things, which is not limited to hospitals. It's a way of looking after organizations. And basically, in short, what happens in an organization that practices the 8 principles of total quality management is that the people in this group undertake to deliver more than is expected from our customers. We regard everybody in this group as customers. So the chief of staff is a customer of the nurse. The midwife is a customer of the doctor. The janitor is a customer of the physician. The person who, the porter is also a customer of the janitor. We are all customers of one another. And the single most important customer is the patient. And we work in such a way that we expect certain things from one another. And the process of instituting the total quality management culture will tell you more about this. But because we have certain expectations of one another, people who are practicing total quality management agree that we will over satisfy the expectations of the different customers. Institutions that practice total quality management will find that there are fewer patient mishaps, fewer patient complications, less dissatisfaction with management. People will be expected to keep up to date with their professional bodies, and so on. This is one thing that the accreditors would be looking for. Having worked in a place before there was TQM and after TQM, I can tell you, it makes a whole lot of difference to the quality of care that's delivered in that hospital. Now, you can't just go and start TQM. Professional advice is going to be necessary, but I think it should be done, and I think it should be ready to be transferred to the new hospital. There is no point in having a new hospital with all of the things that we're talking about, and for the same non-culture that presently exists to be transferred to that hospital, because you will not be making a difference to the patient. And the whole idea, if you're going to get a new hospital, the expectation is that we're going to find a better care for our patients. I would hope that the people, especially the people of Montserrat, especially the ones who live on the island, engaged in this kind of discussion with the government. The government, remember, is not going to own the hospital. Governments come and go, but the people of Montserrat are going to own this hospital, and I want to see them take more ownership of it. I want to see them pursue these ideas and make this hospital the state-of-the-art hospital that it can be. There are various ways of doing this, and some of this might come up in the discussion. So I think it's time for me to stop talking and maybe answer some questions.
Thank you. So thank you, Dr. Daly, for that. And I read through the chat, so I do have written down some of the questions that were presented in the chat. So we'll start off with this one. Would it be appropriate to review the data of illness to determine the critical services that are needed?
I didn't hear the question.
You didn't hear the question? Okay.
Not well, yeah.
You hear me?
I can hear you.
Okay. One of the questions I've put in the chat is, would it be appropriate to review the data of illness to determine the critical services needed? And I know you did talk about the 4 clinical services. Is that from the data that you received, or is it just what you think would be best for a general?
It is based
generally from the island.
Yeah, it is based on my knowledge of what happens in Montserrat, and I think you will find that most general hospitals see these 4 services as the core services. That's not to say that other services should be excluded, but if we had to choose, and we're going to have to choose in Montserrat because of financial restraints and so on, I would think that this would be the area that would give the biggest bang for the buck, as they say.
Okay. And with that in mind, I have my own personal question on that. So will health screenings be one of the critical roles of the hospital, that way to prevent, in the hopes of preventing further issues and illnesses to arise, meaning they'd have to leave the island for care?
Oh, absolutely. Absolutely. That's what I mean when I say that the ambulatory part of the hospital is in many ways maybe the most important part of the hospital. We should have these clinics where screening will go on. In my specialty, for instance, people might be doing pap smears, I don't know, or colposcopy. Certainly, this would be a place for colposcopy. So yeah, that would be the main function of the ambulatory clinics.
Another question was, what are your thoughts on the role of telemedicine in the undertaking of non-elective surgery in Montserrat?
Telemedicine is essential for Montserrat. Montserrat will have to be able to upload data on patients to other places that have the expertise, which we don't have. Telemedicine, as part of a surgical program, I imagine that the questioner wonders whether we can undertake to have somebody from elsewhere perform surgery on a patient in Montserrat through telemedicine, through a telemedicine hookup. That is possible, but it's a very expensive undertaking. And I know people have operated on patients from one continent. People in one continent have operated on patients. Doctors in one continent have operated on patients in another continent. It is possible, but the equipment to do that is horribly expensive. We're talking now about robotic surgery. And I think, yeah, it's technology, but I don't see this happening in Montserrat anytime soon.
Hey, Allison and Dr. Daly, I'm sorry to interrupt you on that. That actual question was actually from the Honorable Premier Easton Farrell, actually. So that was actually great that you actually went into detail on that. But do you think, here's a side question for that, and this one's from me to the Premier, is actually, do you think that the government will be able to eventually in the future subsidize a kind of procedure like that, or, start taking on even the basics of, follow-up care in that sense, even if it means that you're just, a doctor in Canada is just following up on a patient that's in Montserrat that has diabetes and just needs that to be monitored and, with the medication, et cetera. So what do you think on that, Dr. Daly?
Well, I think that's part of what telemedicine is supposed to do. And that's how telemedicine would be used right now. There are many cases that we can treat in Montserrat if we have a telemedicine link. But to have the person in another country actually doing the surgery on the patient in Montserrat is a different type of telemedicine, advanced telemedicine, which I don't think we're ready for. But following up patients, sending data by telemedicine to specialists in other areas and getting feedback so that we can treat the patients in Montserrat, that is needed and should be instituted when the hospital is built.
Perfect. Thank you for that. You can continue, Allison. Thank you.
Okay. Someone also brought up, with your talk about the services that we provided, they were wondering what services will be provided for and to those seniors, especially those with Alzheimer's and dementia.
Again, we were not going to be addressing all of healthcare in Montserrat, and certainly senior care is something that really needs to be looked at. I am not familiar with the extent to which issues like aging issues, Alzheimer's, and other types of dementia are looked after in Montserrat. But generally, this type of illness does not lend itself to much in-hospital care. And so I think it is a little bit outside of the purview that we have today. But a review of all healthcare in Montserrat, I think, is quite appropriate.
And to stick with ideas of like telemedicine and the further medical things, you didn't mention anything about electronic health records and incorporating that into the overall healthcare system.
Yeah.
Is that something that you believe would be important?
Oh, yes.
Or something to think about later on? Or
no, there is much more that needs to be done in this hospital, which we just did not touch. I didn't think we would have enough time. Electronic health records is a good case. Yes, I think that's what is appropriate. Again, most hospitals, if you're building a new hospital and you want to be up front, you want to be state of the art, you want to do things as efficiently as possible, then electronic health records is the way to go. Something else that the hospital should get is a database. The hospital should purchase a health database so that there can be point of care information. There was a time when we physicians used to carry around a lot of information in our heads. And those of us who are practicing medicine for a long time still have a lot of information in the heads, but that's not how medicine is practiced anymore. Every hour, there is more important information being added to medical databases. And in order for any physician or any nurse, any healthcare professional to keep up to date, you have to have access to databases. So a good database will be necessary in Montserrat, where with the click of a mouse button, you can get information which will allow you to provide the most appropriate care for the patient that you're seeing, and will allow you to be practicing medicine as good as anybody else anywhere in the world. So those are some of the other things that are going to be necessary in this hospital.
Right. So you touched a bit on training and the importance of it, and what should go with that. But what is, sorry, I'm reading a question. Let's speak on to training now. How do you, sorry, I'm trying to read the question. Give me 1 second. Okay, so touching on training, how do you plan on cultivating the training and sending people out and not only sending people out for their training, but what about bringing in providers into the island, into the hospital? How do you plan on cultivating that type of system?
Both are necessary. Issues like this are issues that will be undertaken by a hospital that's properly run. If you've got a professional group who are running the hospital, there will be guidelines for this type of thing. Everybody needs to have continuing professional education, and how you provide that education will vary depending on the circumstances. It will be necessary to send people off to get hands-on experience. It will be necessary to do virtual learning, and in many cases, experts would have to come to Montserrat or engage the people in Montserrat through the internet like this. But continuing education is absolutely essential, and how it's done is going to vary with the circumstances. And this kind of thing will be determined by the professional advisory council and the hospital administration. It looks like you're muted again, Alison. I can't hear you. Okay.
Yes, sorry, I'm back now. And then at the very beginning, you kind of touched on the role of government throughout helping with the hospital and as well as the community. What are some ideas do you believe the government can do to implement community interest in the hospital and the development of it?
I'm not sure exactly how this should be done, but I think the government should find a way to engage people. As I said before, it's a two-way street. People in Montserrat need to show the government that they are interested. We as a group wanted to find out what information was available, and we found that this information was readily available. We looked for it, we asked for it, and we were able to speak with someone who provided us with quite a bit of information about this new hospital. So people in Montserrat need to do that, but I think the government should recognize that it's important, if they are not doing it, that it's important that they keep going to the people. They keep letting the people of Montserrat know that they should engage with them. One of the things that people have often asked me about, and some of you are probably thinking about this, is should Montserrat, for instance, have a renal dialysis unit? Should we have kidney dialysis in Montserrat? That's a big question that many people have been asking for many years. I happen to think they should. But the discussion around this needs to be done by people in Montserrat. They need to represent to the government the need for this. I can certainly make a clinical case for dialysis in Montserrat, because we all know that there is a lot of a chronic disease that could result in chronic kidney failure. We have hypertension and diabetes, which are two of the commonest causes of this. And it's inevitable that there will be people in Montserrat who will develop kidney disease as a result of this. And there are people living abroad who can't come to visit in Montserrat because we don't have dialysis. So I think I can make a clinical case, but more people in Montserrat need to make a clinical case for this. But as far as engagement with the public is concerned, I would like to see people grab the bull by the horn and say to the government in Montserrat, we want to make this new hospital a place of excellence. We want to see that people recognize that the quality of care offered in this hospital is the best that it can be, is the best in the area. And there are different ways of doing this. We can link up with other clinical services elsewhere who can provide some of the personnel that we might need to achieve this goal. We can send our people off to train. We can get people the right type of education that's necessary to make this hospital a place of excellence and keep it a place of excellence. That's the kind of conversation I would love to see the people of Montserrat engage in with the government of Montserrat.
Right. So we have about 10 more minutes. I know I've seen multiple times in the chat about the suggestion of making it a university hospital. Some people suggesting it's a good route to undertake, or the idea of it should be something interesting to think about. So do you believe that presenting this as a university hospital would be beneficial, or something to think about after it's there and after we've established the hospital and the needs and care?
You see, I think we've got the ability now to make this into the kind of hospital that university medical schools will use as a teaching hospital. But in order to do this, again, I come back to the same point. We've got to have the right personnel. We've got to have people who've done the right courses, and we've got to have the state of mind which says that this is important, and we need to do it. I know that there is talk about a medical school coming to Montserrat. This would be an ideal opportunity for people in that medical school to get some of their clinical training in Montserrat rather than going overseas where they would normally go. And there are lots of other medical schools, offshore medical schools they're called, in Antigua and St. Kitts and so on, who could use the facilities of a first-class hospital. And yeah, I think attempting to make this into a teaching hospital would be a great idea, but you have to have the will, and you've got to make the government believe that it's possible.
Correct. And with that in mind, speaking with the government, someone had a question of if you have any plans to speak directly with the government about your proposals.
We have,
and any proposals made in the forum.
Yes, we have made a presentation to the government. We're waiting for their response. And of course, we would be delighted to engage in further dialogue with the government. I don't want us to miss this opportunity to do something which is very good for Montserrat and very doable. So yeah, we've made a presentation to the government.
Great. So we have about 7 more minutes. Are there any questions that I've missed that anyone would like me to go over before I ask Dr. Daly to give his last couple of key points? Okay. Dr. Daly, do you have any more key points you'd like to give before we end this session?
I hate to sound like a broken record, but
No, no.
the thrust of this presentation is that we've got a golden opportunity to do something that is first class in healthcare in Montserrat. The arrival of the new hospital is an opportunity to do that. We can make it into a center of excellence. The opportunity exists for this. We happen to be living, Montserrat happens to be in an area where minimally invasive surgery is still in its infancy. We have the opportunity to create a center of excellence for minimally invasive surgery. And hopefully, the government will see the possibility of doing this. And there are other spin-offs which can be good for the government, for Montserrat. The whole issue of health tourism is one which is really not looked into very much. Here is a golden opportunity for health tourism. I wanted to also say that I just want to give a shout out to my cousin Jenny, Janine, sorry, who's here. I wanted to also say, oh, I've lost my train of thought. Thanks, Janine. Whatever, it might come back.
You touched on health.
Here's what I was going to say. Here's what I was going to say. There are people who are trying to raise money to purchase equipment for the hospital. I commend them for this, and Ms. Daly, Nurse Daly, can talk to this much more than I can, but I think that other people around the world, Montserratians around the world, ought to get involved with this hospital. It's probably not a bad idea for there to be groups, that well-organized groups that will have the interests of the hospital at heart, and who would be willing to do whatever is necessary to maybe start a foundation or something of that nature, and do what is necessary to propel this hospital into the stratosphere where it certainly can go.
Great. Are there any more questions?